All right. So we only have an hour together, so I'm going to go ahead and get us started. Thank you all for being here. If you do not know me already, I'm Megan Fitzgerald. I am the Family Treatment Court Training Coordinator for the grant that we are um, uh, working on through the OJJDP and the Washington State Administrative Office of the Courts. We're here today mostly to have a hopefully robust discussion about some of the challenges that we see in access for our rural courts, as well as just a little bit of information about some of the research that's coming out, a little bit of information about some resources that hopefully we can guide you to, and then hopefully we really can hear from you about some of the things that you've been doing over the last couple of years that might have changed the ways that you work with rural participants in our courts. So I'm going to start off, first of all, with just an acknowledgement of all of the partners on our grant. Of course, we have the Center for Children and Family Futures, CFF. You've probably been at least a few of their trainings. The DCYF is one of our partners, as well as the HCA within Washington State, and the AOC, where most of the grant folks work. And I also just want to mention that we are truly dedicated to having a meeting that has inclusive and equitable access to all of our information. Please do give me feedback directly if there's any way that we can improve. There are many resources that are on the website that I'll be sending out to you as well. So definitely, if there's ways that we can change that or modify it to make it more accessible, we're happy to do that. And then as we're going towards the 4th of July, Gia, could you keep admitting people in from the waiting room? It looks like there's still a few people trying to join. So as we're going on to the 4th of July, we know that we're thinking a lot about Independence Day. Maybe we're just thinking about having a day off, but I think it's also really important to just acknowledge that the 4th of July is a time to celebrate independence for many of us. It's also a time of remembrance of great difficulty and an extreme amount of loss for others. So while we're coming together in this meeting, I want to acknowledge the land that we're on right now. The boundaries of Washington State include the unceded and occupied lands of numerous tribes that have lived along the coastal and inland areas in this continent since time immemorial. And I would like to just have us take a moment of silence to acknowledge the beauty of the land where we live and work, the many sacrifices, historic and current, traumatic experiences that have brought us to this privileged place that we come to currently, and the immense strength and resilience of the tribal peoples who are still here today. So if you'll just take a second to just think about where you are located, have a little bit of gratitude for that trauma and historic geographic and ecological change that has happened over the course of the time that we've been in this land. I'm coming to you today from the Olympic Peninsula, from Port Angeles, which is in Clallam County. There are a number of different tribes in Clallam County. Where I am currently, the Lower Elwha tribe is the most local, and they're doing some really great things with some of their work in the area. So I just want to acknowledge that. From my personal location, if you'd like to put a little bit of a comment or in the chat about where you're coming from, we'd appreciate that. Feel free to share whatever seems to come to you at this time. So I'm going to keep moving on through here, because again, we don't have a huge amount of time together today, and just give you a little bit of background about why we put this meeting together, so that you have some idea of where we're coming from and why we thought it might be important to just continue having conversations about this. So this is a little bit of a chart from from a website that you can't see because it's behind me, HRSA.gov, where you can get lots of information about what's called health professional shortage areas. And these HPSAs are, just an area that we can see how much of a deficit there is in providers for people in that area. So I know this is really small, and the slides are available online, and I'll give you that website shortly. In fact, Gia, if you want to put that up into the chat, that would be helpful. So in a number of states in the country, we have just a huge dearth of providers within mental health, within primary care, even dental health. And you can see across the sort of right-hand part of this that the Washington state is up there towards the top. So that means we have a higher level of need than some other places. Currently, according to these charts, we need about 7,632 new practitioners for mental health services, and that includes substance use providers. It includes treatment facilities. It includes, individual one-on-one therapists. So there is a huge, huge, huge number of providers that are still needed, and that tends to impact rural areas just a little bit more. When we look at Washington State, so this is just a snapshot map that I took today because it does change to a certain extent over time as more data comes in, where you can look at those brownish sort of colored areas. Those are considered medically underserved areas. So we have a number of those, especially on the east side of the state. And then we also have these mental health areas. So that's the areas in blue. And sometimes when they're overlapping, you can't see both at the same time. But again, this is just sort of general. The website is really interesting if you want to go in there and just sort of play with it. I'll make sure that that's on the website as well. I'm pretty sure I already put it in there. And just sort of look at what your area is dealing with. The data is not complete in all of those areas, but one thing that's definitely sure is that many of our family treatment courts and healing to wellness courts come from areas where there is a health professional shortage, particularly in the area of mental health, which is, of course, really relevant to our family treatment courts as we're trying to get people into services for treatment of their SUDs and use disorders. We also know that people are talking about mental health now more than ever. I think that's pretty clear from just looking at news stories, but this study was really an interesting comparison of pre and post onset of COVID-19 tweets, so from Twitter. And of course, this is a subset of people who are already really comfortable being online. But what they were looking for is people that were talking about both telehealth services. That was the first sort of qualifier that they look for that pared down the tweets, and then looking for health or mental health providers. And if you're just looking at the colors, it doesn't actually tell you that much. But when you look at the scale down here, so this is on the left-hand side, the pre-COVID pandemic tweets only goes up to 1,000, and there's still a fair number of tweets in there. However, when you look at the post-pandemic tweets, the frequency goes up to almost 8,000, and we have at least 4 times the amount of tweets about mental health, substance use, and telehealth all at the same time, where frequently it's either trying to find providers, positive outcomes from their telehealth, or negative outcomes from their telehealth. So this doesn't really tell us anything about what users are necessarily experiencing, but it does tell us a lot about the fact that people are discussing this means that it's something that's relevant. The researchers in this study think that it's relevant to demand of need for telehealth services. I don't know that I necessarily agree with that, but I do think it's interesting to look at these different types of data set as we're thinking about how to, gather information from different places. We also know that there are differences in services between rural and non-rural areas. That's been true since previous to the pandemic. There's a number of different research studies that all have linked as well that show that rural areas tend to have higher telemedicine use. They tend to have more solo practitioners or providers. So if you have an SUD treatment center, it might have only one person that's really providing clinical care. And there's also less evidence-based practices. This isn't a huge extreme if you're thinking about like one practitioner doing only one type of evidence-based care, that kind of makes sense. But there is sort of a scope of scale where you just tend to see more people who are using less evidence-based practices in rural areas than they are in more urban areas. And that can cause some difficulty, especially when we're thinking about data collection and how to make sure that we're doing effective work. One thing that was really interesting, though, when I was digging into some of the research about these differences between rural and non-rural healthcare, particularly in telemedicine, this study of pre-pandemic use, but it was a huge number of people that they were looking at, found that people who are in rural areas, so that was like the first barrier for people in rural areas who access telemedicine more, also accessed in-person care more. And that was specifically looking at people who had mental and substance use disorders and how they were interacting with their Medicaid services. So there are a few different reasons that we could look at for this. We don't know that there's cause, right? We only know that that's true. We know that if you went to more telemedicine visits, you also went to more in-person visits. But based on some other things that I've read and some speculation by the authors, it does seem possible that more contact means that because they're reaching their providers more often via telehealth, then they're more likely to continue with treatment. They're more likely to have fidelity to their treatment model. And in some cases, that showed more success. Now, there is more data that's coming out on this now because there's such an increase in telemedicine. It also means there's a lot more increased data. And so I think over the next few years, we're going to continue to see more information about this, including more user surveys and things like that can give us a little bit more information about the practice and how people respond to treatment in the longer term. So that brings us to why we're here today. So we want to think about how do we help families in rural areas to receive equitable care. One of the things that we'll do is we'll provide some research that's available. I have a full literature review that I've been working on with some summaries and abstracts from various research articles. You should be able to read that. I'm going to show it to you in a second and just sort of go through and see what might be helpful to your court, right? Not all of the things that are included on there are useful to you, but many of them might be, and it gives you some information to go for further reading. And then we'll also specifically talk about further barriers that we should bring forward to our steering committee or other stakeholders, thinking about, legislative sessions in the future and places where we should be going to sort of move up the chain of command and see if there's areas that we need to be thinking about more. As well as opportunities to share any sort of innovative techniques, methods, how you've been getting through the past few years. So that's our basic plan for today. I'm going to do just one more thing where I talk with you. I've just got to switch from my PowerPoint to our website. All right, so you should be able to see our website right now. So this is the WASITA website. And this is just a site that a quick page that I put together with all of the resources from that lit review that I mentioned. As I'm going through this gives you a PDF copy of the slides that are used. So you can download that if you'd like it. There's nothing really interesting in there that isn't in the research that's below there, but you're welcome to it. This also will have a little video of this beginning section of the basic overview that I talked about there. I have this separated into family treatment court specific research. It's a really, really small section, unfortunately, but I'm hoping that I'll come across other things in the future and I'll add those here along with some, summaries of what you might want to look for. And I'll put something out on the listserv if there are things that are really interesting. I did include this study of triple P in high-risk families in rural areas. So this is using the triple P parenting method. It's a very strongly evidence-based method of teaching parenting tools. And what they did was they looked at high-risk families in very rural areas and they went into the homes. So there have been a number of different studies on triple P about different levels of care where you have triple P in person, with groups, with self-led care, and then with telemedicine or video medicine. But they hadn't done a study of home-based care. So what they found is that Triple P was effective in all of those contexts, although when you're doing a self-led Triple P route, then it's beneficial to have additional client or a clinician check-in. So maybe not fully an in-person a situation, but maybe an additional clinician check-in. And if that check-in is in the home, then it's possible that that's actually very appropriate for certain cultural and demographic groups, particularly families that come from Latino backgrounds, tend to have a really high context or a high family-based cultural system. And having those home visits for Triple B can make that a little bit easier to access and a little bit more culturally appropriate. So it's a good study. I think it's worth reading, especially if you're in the parenting sort of area, or you give advice about parenting programs, or if you have parenting programs that are part of the services that you give to folks. I also have a whole section on SUD and mental health services, lots of good stuff in there, including a few of the ones I talked about today, a section on cultural and racial disproportionality in rural areas, and then just a couple of general papers about justice in rural America related to SUD. And that just will give you something to start off with. All of those are available for download, so you don't have to worry about whether they're behind a paywall. Those are all on our website, so you can get to those and access them relatively easily. One more thing that we have today is we've asked a couple of folks to come and join us today, Adrienne Mason and Alicia Summers. So I'm going to ask them just really quick to give yourself a little hello. And they're just here mostly to join in our breakout rooms to answer questions about anything that you might have questions about, and maybe as a resource of someone you can contact if you have further questions. So Alicia, would you mind introducing yourself just a little bit?
Hello, everyone. My name is Alicia Summers. I do research and evaluation and provide technical assistance to child welfare courts all over the country, including with a focus on hearing quality. And we've done some work recently looking at differences in virtual and in-person hearing practice.
Yeah, if you look to this first section of the website that we have up, there is a whole host of information from Alicia and her group, and they've done a couple of seminars. They've done some really good sort of background on how to deal with court practices, particularly in dependency. So definitely check those out. We don't want to reinvent the wheel and bring those here, but I think it's well worth looking into that research. And then Adrienne Mason.
Hi all, my name's Adrienne. I use she, her pronouns. I'm the regional director for Children's Home Society of Washington. I'm located down in Southwest Washington, Vancouver-ish. We provide a bunch of services robust to families, behavioral health, family support, and we do a lot of direct contracted work with our local family treatment court, parenting classes like Triple P, which we do in-home, in community, and virtually. So I think I'll be able to answer some of your questions just kind of about virtual services and what that looks like. Yeah, that's me. Glad to be here and nice to meet you all.